How to avoid prenatal B strep infection. Group B strep is a bacterial infection that affects the vagina, rectum, and intestines of up to 25% of women in the United States. It is not a sexually transmitted infection, it is not transmitted through food or water, most women experience no symptoms. And many women are unaware that they even carry the infection. The bacteria can live naturally in your gut and may come back even after treatment with antibiotics. So unless you are experiencing symptoms of the infection during your pregnancy, most healthcare professionals will not treat you until you go into labor. Group B strep can put your baby at risk of a dangerous infection, so it is important to get tested and receive 4 antibiotics during labor if your test is positive. Getting tested for Group B strep infection. Maintain regular prenatal visits. Seeking prenatal care early and continuing with your prenatal visits throughout your entire pregnancy will help to increase your chances of having a healthy baby. Your doctor will screen you for Strep B during your 3rd trimester, and during this trimester you will need to see your doctor about once every 2 to 4 weeks. If you have not yet had a prenatal checkup, then schedule one right away. If you have to miss an appointment, then reschedule it. Get tested for B strep in your 3rd trimester. Getting tested for B strep is a normal part of prenatal care. You will be tested around your 35th through 37th week of pregnancy. If you test negative, then no extra precautions will be necessary. If you test positive for B strep, then you will receive 4 antibiotics during labor. The test is easy. Your physician will just need to swab your vagina and rectum. Then, the swabs will be sent to the lab and the results should be available from the lab within 48 hours. You may even be able to do the swabs at home on your own. Most obstetricians and midwives offer testing for B strep beginning the 35th week of pregnancy, although you can obtain one earlier if you are concerned. Watch for symptoms that you may be high risk. Some women are at high risk because they have already had a baby that contracted B strep. But there are also some symptoms that may indicate you are at high risk of delivering a baby with B strep. You may not have any symptoms of B strep, but if you do, then you are considered high risk. Symptoms to watch for may include having a fever during labor, going into labor early or rupturing membranes before 37 weeks, having a labor that lasts longer than 18 hours, having a urinary tract infection due to B strep prior to labor. Keep in mind that there is no way to prevent Group B strep in adults. Although there are things you can do to reduce your baby's chance of getting Group B strep, it cannot be prevented in adults. There is no vaccine available and no special precautions that you can take. However, the infection is usually harmless, so you probably will not need to worry about it. Preventing Strep B during labor. Recognize the importance of receiving antibiotics. Do not assume that because B strep is harmless in your body that it will not harm your baby. Group B strep may cause sepsis or meningitis in babies and may also cause pneumonia, all of which can be debilitating or deadly in infants. A baby that contracts Group B strep may also suffer from kidney problems, gastrointestinal problems, difficulty breathing, and unstable blood pressure and/or heart rate. Keep in mind that not all mothers who have Group B strep will pass it on, but antibiotics helps to reduce the chance of passing on the infection. Do not rely on oral antibiotics prior to labor. A previous course of antibiotics may reduce the B strep bacteria for a short time, but it will not protect your baby during labor. B strep can live in your body and you may carry it regardless of whether you were previously treated with antibiotics or herbal remedies. If you tested positive for B strep prior to or during your pregnancy and followed up with a course of antibiotics, it is possible the infection may have returned prior to delivery. Ask your healthcare professional about your options. Depending on the type of delivery you have, your options may vary for avoiding passing B strep to your baby. If you have a planned surgical delivery due to particular health needs, You may not need 4 antibiotics for yourself or your baby unless you naturally go into labor before the operation begins. However, some doctors will still give 4 antibiotics even if you are having a cesarean section. If you intend to deliver vaginally, you may be started on antibiotics as soon as labor begins to prevent your baby from becoming infected by coming into contact with the bacteria in vaginal fluids. If you are allergic to penicillin or another antibiotic, be sure your medical team is aware so that they can offer an alternative antibiotic in the 4th fluid or treatment they provide. Accept treatment with antibiotics during labor. If you tested positive for B strep, then you will need to have antibiotics via N4 during labor. This will reduce the chance of passing a possible B strep infection to your child from 1 in 200 to 1 in 4,000. If you do not know the results of your B strep test or if you were unable to get tested prior to delivery, most healthcare professionals will opt to treat you with antibiotics during labor to be safe.